Hello, this is Chris Trashevsky. I'm the nurse at Pritchett. My fellow nurses and I have put together this slide presentation to go over COVID 19 as it will affect us going into the school year. COVID 19 is a close relative of the SARS and MERS virus, and they all belong to a family of viruses called coronavirus. Some of these viruses cause the common cold. COVID 19 has mutated, but the mutations have been small. Since it is so easy to spread between humans, there is no evolutionary pressure to mutate and evolve, causing the mutations that have happened to be indistinguishable in its symptoms. But it is making it harder to develop a vaccine. Europe is primarily strain B with some C, and strain C is the most limited in its spread to Asia. In December of 2019, the first case was identified in China, which likely occurred when the virus transferred from an animal to a human. From there, travelers have spread the virus into other countries, causing this pandemic. What do we know now? We know that it is a virus and antibiotics are ineffective unless there is a secondary bacterial infection. It has a lipid or fat layer that makes it vulnerable to soap and rubbing alcohol. Latest research shows that it does not live long outside the human body. This virus is extremely contagious, possibly short immunity, and no vaccine yet. It is one of 7 coronaviruses that infect humans. Most recover in the United States, 96.7%. Last year, 24 to 62,000 died from influenza in the United States. As of September 22nd, 2020, over 200,000 have died from coronavirus 19 in the United States. There are currently no drugs licensed for the treatment of COVID. Pneumonia vaccine has no effect, but all recommended vaccines should be up to date. Children generally have mild or sometimes asymptomatic illness. Most cases are mild, but some are severe and can be fatal. There seems to be long-term effects for some people, but it's too early in the virus's life history to know the severity and length of the side effects. Symptoms start anywhere from 1 to 14 days after exposure. Some people have no symptoms, while others have mild symptoms. When you say mild, this can vary from feeling like a nasty cold to being almost bedbound and at home for an extended period of time. For others, the illness can be severe, requiring hospitalization, and can even cause death. Scientists don't understand the reason for the variability at this time. There are lots of theories, but not enough study has passed. As of September 10th, 2020, IDPH released guidelines that state that students or staff should not attend school and/or should be sent home from school if any of the following symptoms are present. They are a fever over 100 degrees, new onset of moderate to severe headache, shortness of breath, a new cough, sore throat, vomiting, diarrhea, abdominal pain from an unknown cause, new congestion or runny nose, new loss of sense of taste or smell, nausea and fatigue from unknown cause, and muscle and body aches. Medical intervention and testing are strongly recommended for all people with COVID-like symptoms. Isolation and quarantine guidelines will be followed based on the most current guidelines. It is believed COVID 19 spreads mainly through respiratory droplets that leave an ill person via their talking, coughing, or sneezing and land in another person's mouth or nose that is nearby or possibly inhaled into their lungs. Spread is more likely when people are in close contact with another person, that is, within 6 feet, with a high incidence of spread in indoor areas. You can be infected by a person with very mild to no symptoms.
So, some ways to prevent COVID 19: maintain hygiene, wash your hands. Soap and water is best for hand washing, but at least 60% alcohol based hand sanitizer is fine if you're in a pinch. Cover your cough. Don't share personal items like food, drinks, or items such as your cell phone. Avoid exposure. Maintain physical distance. Don't shake hands or give high fives. Avoid touching your face. Avoid large groups of people. Avoid staying inside with non common contacts for extended time. And keep away from people who are ill. Also, make sure you're wearing a face covering when indoor public places and when confined or in crowded spaces. So, this is a little bit about face coverings. Face coverings are recommended for all people 2 years of age and older. They must cover your nose and mouth to be effective. Don't put the face covering around your neck or up on your forehead. Don't touch the face covering, and if you do, make sure you wash your hands. There are adaptations for specific situations. N95 are critical supplies reserved for healthcare workers and first responders as recommended by current CDC guidance. So, a little bit about hand hygiene. Make sure you use warm water and soap. You'll want to scrub all surfaces of hands, fingers, nails, and wrists for 20 seconds. And make sure that the hands are not under the running water for the 20 seconds and that you're actually scrubbing them. You can sing the happy birthday song 2 times or the ABC song. Rinse thoroughly, dry thoroughly, and then you may use hand sanitizer if soap and water is not available. And then there's a YouTube video you can go to watch to see how to properly wash your hands. For face coverings and PPE, everybody is required to have a face covering. Face shields and or clear plastic barriers are for speech-language pathologists, speech-language pathology assistants, or other adults providing articulation therapy, and the front office staff. Face masks and shields for school RNs or other personnel when providing direct contact care and monitoring of staff or students displaying symptoms. School nurses should also wear appropriate PPE or personal protective equipment for their role. ADA accommodations: if a staff member requires an accommodation for the face covering or face shield requirements, they should contact HR.
Now, let's review the proper care of face coverings and shields. Use a clean mask daily. Replace if it becomes soiled or wet. Remove and place the mask using the ear loops. Do not touch the front of the face covering. When not in use, place the outside surface of the mask on a tissue or paper towel, or place the mask in a paper bag. Dirty masks should be placed in a plastic bag for transport home in order to launder. For best effectiveness, use a face shield with a face covering or mask as able. Disinfect the face shield daily and as needed throughout the day with appropriate cleaner and wipe dry. While wearing gloves, carefully wipe the inside, followed by the outside of the face shield using a clean cloth saturated with neutral detergent solution or cleaner wipe. Wipe the outside of the face shield with clean water or alcohol to remove the residue. Allow the face shield to air dry, or you may dry using clean absorbent towels. Then remove your gloves and perform hand hygiene. Health Office guidelines and procedures have been amended slightly this year based on the pandemic. In order to prevent potential exposure to infectious diseases, promote isolation, and decrease health office congestion, do not send students to the health office with the following common situations. Paper cuts, small abrasions, and pick scabs can be treated by having the student wash the area and apply a Band-Aid if needed. If a student has a bloody nose, please hand the student several tissues and ask them to squeeze their nose tightly at the nostrils for several minutes. They should not put their heads back, as that will make the blood flow down the back of their throat. After a few minutes of pressure, if the nosebleed has stopped, the student should wash their hands thoroughly. The custodian may need to be notified to ensure that all blood has been cleaned up from the area. If the nosebleed is persistent, call the health office for further instructions. For localized bug bites, if there is no allergy history and the bite is not spread over a large area of the skin, the student may apply a cool paper towel to the area to help prevent scratching. There will also be sting kill wipes provided in a first aid kit that you may use. For any potential anxiety or stress not affecting breathing or medical health, use our typical tools of a snack, redirection, or resting in order for the student's symptoms to be relieved. For headaches, stomach aches, nausea, or suspected fevers, please call the health office first. We might come to assess the student in the classroom, or we may not be able to see them immediately depending on the current situation in the health office. Each classroom will be given a classroom first aid kit to care for minor first aid concerns. These kits will include Band-Aids and gauze, wound cleanser and gloves, sting kill wipes, facial tissues, and paper cups for water. Pritchett, Tripp, and Meridian schools will also have treasure chests for lost teeth in the kits. What is the procedure for quarantine or isolation? If a staff member, a student, or other member of the school community becomes ill or has been exposed to an individual confirmed positive for COVID-19. Current CDC, IDPH, ISBE, and Lake County Health Department guidance will be followed. At the directive of the school nurse, the individual would be placed in isolation and evaluated. Arrangements will be made for safe transportation home. And if there are confirmed or presumed positive cases of COVID-19, there are several conditions that need to be met to safely return to school. 10 days minimum must have passed since the symptoms first appeared for a positive case. If a student or staff member is symptomatic but does not have testing, a minimum of 14 days needs to pass since symptoms first appeared before they can return to school. Their symptoms must have improved before they can return. They must be fever, diarrhea, and vomit free for at least 24 hours without medication before returning. And we will also follow specific healthcare provider instructions that have been given to us by the student or staff member's doctor.
So to be notified about exposure. In partnership with Lake County Health Department, the district will provide clear communication to notify staff and families of COVID-19 case management. This will follow the IDPH and CDC resource guidelines. Keeping up with attendance will be crucial this year. Each absence will involve a follow-up by the school nurse. Please be aware that in these unprecedented times, FERPA must still be followed. The nurse becomes aware of a confirmed COVID case, she will call the hotline and notify appropriate staff, and that would be close contacts. If you find out about a COVID case, please make sure to let your nurse know so that we can take the appropriate steps. The nurse will remain in close contact with Lake County Health Department and will keep you updated as the situation evolves. As we're all aware, this pandemic has been and will continue to be very fluid and often has changes in guidelines. We have put together some practical suggestions to help everybody. Please try to start teaching yourself to not touch your face. Make sure you wash your hands frequently. You want to change your shoes before and after work. You can also store your shoes in the trunk of your car. But we strongly suggest that you do not walk around in your shoes that you worked in. Keep an area in your car that is designated as a dirty area, and please do the same in your house. It's suggested that when you get home, change your clothes, throw them in the washer, and shower when you get home. Wear face shields if you have them, and make sure to label them with your name. If you don't wear glasses, you can even get a pair of fake ones. This will help protect all of the entrances, our eyes, nose, and mouth. There are many products that you can hook the ear loops of your masks on. Ears tend to get very sore after wearing masks for long periods of time. There are some fun ways. There are headbands with buttons and plastic holders that go behind your head that can help with this. Facial wipes will become your friend. Wiping your face every few hours when you get a break from your mask will end up being the best part of your day. And keep sanitizing wipes and hand sanitizers in your car. Remember to wipe down your keys, ID badge, laptop, watch, and especially our cell phones. Keep as much as you can in your trunk to minimize the things that you are bringing in your home from school. COVID-19 can be very stressful, and the effects can be both physical and emotional. This has been a rapidly changing situation, and it seems like the guidelines keep fluxing. Fear, anxiety, isolation, loneliness, and frustration are common experiences. When these feelings are extended for a long period of time, they can result in physical symptoms, such as headaches, muscle aches, sleep disturbances, GI tract disturbances, chest pain. If this stress is keeping you from your daily activities for over 2 weeks, or your anxiety or physical symptoms are escalating, we suggest that you talk to your doctor or someone that you trust. There are things you can do to help lower your stress, especially take a break from social media and news. If the stress keeps you from daily activities longer than 2 weeks, or you feel it escalating, again, try to talk to your doctor or someone you trust. Engage in activities you enjoy. Going outside for a walk is a great distressor. Eating healthy and getting enough sleep are also helpful to help us manage stress. And as always, practice positive thinking and mindfulness. If you have any questions regarding anything you saw in the slides, please feel free to reach out to your school nurse, and she will be happy to address any concerns that you have. And of course, as we start bringing back kids and going through the school year, we're always here to help you with any questions that you may have.